Do you have any unexpected emotional surprises from patients or family members that come to mind?
When I think about that, I think about where cancer is right now, and it is skewing younger and it's skewing female. And so what comes up what I learned and was surprising was for young adult cancer patients and survivors, they have a unique set of circumstances, right? They are looking at fertility issues, employment issues, raising children, maybe not being as financially stable as their older counterparts. They're also focused in on relationships, and so they come with a unique set of circumstances and then also barriers because childcare becomes a barrier. Being able to go to anything extra and take off time from work becomes a barrier. In that regard, I think having psychosocial services that can be both virtual and in person. So if you're looking at a virtual, healthy lifestyle class, they can essentially do that. It's affordable. They can do that anytime that they want. If it's something that's a recorded program, they can be able to reduce transportation time because they don't have to drive somewhere. So I feel like that's one of those areas where it can really benefit that certain group of individuals. So that was surprising to me.
And I want people to understand this. The first thing she said was cancer is skewing younger. And she's right. But what you guys are going to take from this is going to be like, oh my gosh, there's more cancer in younger patients. Like, what are we doing? What's wrong? Cancer mortality overall is going down, number one. And then number two is you have to think about the screening process. Because we can screen people so well, we're diagnosing it earlier, which improves outcomes over time. Now, from an emotional perspective, which she was talking about skewing female, again, I hate to bring this up. I just think about my wife with breast cancer. My wife had another surgery this week. And the surgery she had, it came up, are we going to have another kid? Do you want to have another kid discussion? This is another thing you brought up, fertility, right? This was another thing that's brought up because when you're going through certain therapies, like there's certain hormones that get inhibited, like with breast cancer, like estrogen. And so then you have to start thinking about fertility and can you have another kid? And if you do go off of it, like what's going to happen to the microscopic cancer cells that may be present? There's all these emotional, I don't want to say consequences, but emotionally normal feelings that you're going to go through as a family. I think it's awesome that you think about all this and you have that experience to deal with all of this.
And when we say younger cancer patients, we're referring usually to patients under the age of 40. And in that group, we're seeing a lot of breast cancer, a lot of testicular cancer, a lot of thyroid cancer, which you're right, now we're screening a lot more of. And then to your point, our generation is having families a little bit later, starting their careers a little bit later. So you're getting that 30-year-old range that's now being diagnosed with these types of cancers, and they're in this big transition in their life.
Sure. The other one that I just throw out there too is the colorectal cancers as well. So seeing all of those. And, we have our general cancer patient groups, but we also have our cancer specific groups. And so we can see that those groups are growing larger in the colorectal and the lung cancer, the breast. We have 5 newly diagnosed breast cancer groups a week. So, I mean, just within that, of course, so number one diagnosed cancer, but, we're seeing it get diagnosed younger, before a mammogram even. And I think people are becoming more aware too of being in touch with their body and what their changes are so they can reach out and get some medical help and then hopefully emotional support.
Yeah.